Hey everybody, this is Frank Cawley from Cawley Physical Therapy and Rehab, and I'm here today. I wanted to share some information with you regarding a topic that we hear a lot about and see a ton of information about, and we just wanted to offer some clarity to people and also let them know that there is an opportunity for help out there. This particular topic is peripheral neuropathy. So when it comes to neuropathy, there's a lot of different questions and concerns about that. And we hear people asking us tons of different questions. So we want to try to offer some advice and some recommendations here about there are potential ways that you can heal naturally without the need for chronic prolonged medication usage or other type of drugs. So we're looking at here reducing pain, improving your balance, and decreasing falls. Because neuropathy really causes a lot of these different issues, all right? We have a lot of different staff that present on these things. A lot of our doctors will cover the neuropathy topics and other topics for you. But again, I'm Frank Cawley from Cawley Physical Therapy and Rehab. I have my master's degree in physical therapy that I obtained about 20 years ago from Hahnemann University. And I've been treating patients now for over 20 years and have a lot of experience dealing with this. And this is one of the most fantastic things I've seen that has come across for neuropathic related patients in a long time. So first of all, there's a couple different types of neuropathy. So there's peripheral symmetric neuropathy, and this is the one that affects the feet and hands. It's the most common form is diabetic neuropathy. So peripheral symmetric neuropathy, the most common form is diabetic neuropathy. Another type is autonomic neuropathy. And this occurs in the nerves that control involuntary functions of the body. This could be things such as digestion, urination, and your heart rate, all right? There's also some things known as thoracic and lumbar root or proximal neuropathy. This damages nerves along a specific distribution in the body, such as the chest wall or the legs. Neuropathy sometimes could be interchanged with radiculopathy, and these are two totally different things. And then there's mononeuropathy, mono meaning singular, so this can affect any individual nerve. So what I'm going to cover today, though, is mainly the peripheral neuropathy, and I want to cover with you how it feels, what the symptoms are like, basically the types, the major causes, how peripheral neuropathy is diagnosed, and treatment approaches commonly used, and then our treatment approach and how we can help you, all right? So first, you need to know a little bit about there's two different types of nervous systems. You have your central nervous system, which is your brain, and your spinal cord, all right? That's the central nervous system. Then you have your peripheral nervous system, which is everything that comes off of the brain and spinal cord, such as the nerves that go to your arms, your chest, your back, your hips, your legs, and all the way to your feet. So those are the two different types of portions of the nervous system. So what actually is peripheral neuropathy? So neuro, break it down. Neuro means nerve, pathy, meaning suffering or some form of disease. So peripheral neuropathy is a condition, usually due to injury or disease, that causes one or more peripheral nerves in your body, typically the legs or the arms and into the feet and hands, to not work as they should. So peripheral nerves are really responsible for your sensations, so determining the difference between hot and cold, sharp and dull, light touch, something that's rocky versus flat, things like that for your feet, okay? It also helps, though, with things such as muscle function and movement. So there are two different components there. Believe it or not, there's more than 40 million people in the U.S. that suffer from peripheral neuropathy, and 8% of the world population suffers from it. So it's a big number, all right? So diabetes is one of the biggest causes and is one of the biggest things you see, the causes in developed countries. So 50% of diabetics will get peripheral neuropathy. That's a scary number, really scary. In the United States alone, the healthcare costs are over $4 billion. That's a lot of zeros. At least 10% of the people over 40 years of age get neuropathy, and about 20% of those patients are receiving cancer chemotherapy. So that can be related to that as well. So how does peripheral neuropathy feel? So some of the common symptoms that people will say are numbness and tingling in their hands, feet, legs, or arms, all right? They'll feel the inability to feel contact with the ground or the pedals in a car, which could be very dangerous situations for a fall or an accident. There's an abnormal sensitivity such as an example, the inability to tell whether something is hot or cold, or whether you're standing on sand or rock. That's a big problem. Pain, it's often described as burning, sharp, or throbbing, okay? Many people experience clumsiness and decreased coordination. If you can't feel the sensation through your feet, a lot of times you can lose your balance or become clumsy. There's also weakness or paralysis in the muscles of the legs and or the arms. And there's a feeling of imbalance on level and on uneven surfaces, going to be worse on uneven surfaces. So, and oftentimes people feel the need to use a cane, a walker, or some other form of a stabilizing device, or even a wheelchair for safe mobility purposes. So, common types of peripheral neuropathy. So, peripheral neuropathy affecting one nerve or a small group of nerves is called focal or mononeuropathy. It often improves over time if it doesn't get too severe. Peripheral neuropathy affecting many nerves, so multi on both sides of the body, is called polyneuropathy, poly meaning many, P-O-L-Y. This affects both the motor, so the muscle strength and the function, so your ability to really get a good strong grip or stand strong or up on your toes, and sensory nerves, so your ability to feel sensation. And it only gets worse without expert treatment. Then there's small fiber neuropathy. There's often pain associated with this, temperature distinguishing issues, heart rate and breathing can be affected, and it's often not detected with the standard nerve conduction studies, such as a NCV, nerve conduction velocity study. So then there's large fiber neuropathy, where you can have vibratory changes, proprioception. So that's your ability to kind of coordinate and maintain position in space. You're tripping over your own feet, so to speak. There's weakness associated, and people get a lot of pins and needles sensations. So bottom line is, peripheral neuropathy, guys, is bad, very bad. So one of the major causes that we see with this is you'll get wounds and amputations. It's going to lead to that. It's going to lead to falls among seniors, up to 20 times more likely to fall each year, and 6 times more likely to fall repeatedly. And for those of you who don't know, people who fall end up in hospitals and end up in nursing home and lose their independence. Bad things. There's chronic pain associated with this. There's lack of mobility and decreased health. And depression is a big thing. Peripheral neuropathy really takes the fun out of your life, okay? So it can be caused by many things. There are more than 100 proven causes of neuropathy, but the major causes are diabetes and prediabetes. So one of the things with prediabetes is a lot of people don't even know that they have it. And there's already damage that's being done, which is a big problem. Chemotherapeutic drugs can cause it. Other drugs such as statins, which are like your cholesterol-based medications, things like that. And certain antibiotics can even do that. So that's something you could discuss with your physician. Chronic infections, and then believe it or not, for neuropathy, for some, 25% of all the cases, it's unknown. They don't know what causes it. So, but here's the thing, regardless of the specific cause, peripheral neuropathy involves a couple things. It involves inflammation, oxidative stress to the cells, which means changes in the circulating in of the good things and circulating out of the bad, and then impaired cell metabolism and function. So when you impair cell metabolism, you might look at your arm and look at it as an arm, but that arm is made up completely of cells. So if you affect the metabolism and the life cycle of those cells, they're going to slowly but surely break down. So in diabetic neuropathy, you're going to see progressive changes begin even before the diagnosis of diabetes. We kind of alluded to that already. So how is it typically diagnosed for peripheral neuropathy? So clinicians who are experienced and trained in peripheral neuropathy can determine if you have it and its probable cause. Comprehensive testing would include anything such as reflexes, light sensation touch, vibratory sensation, muscle strength, balance, pain assessment, detailed medical history, and answers to the proven tests for peripheral neuropathy. Now, there's a lot of drug treatments for peripheral neuropathy, okay? So drugs are mostly used for pain in peripheral neuropathy. So let's just be clear. When you're taking drugs that are used for pain, they're merely masking or blocking the symptoms of pain. They're really not doing anything for the resolution of it. And here's some of the most commonly used drugs for peripheral neuropathy. Antidepressants, one name brand is Cymbalta. Anticonvulsants, one name brand is Lyrica or gabapentin. Another one is narcotics, such as tramadol or Percocet. So all of these things, none of them address some of the causes and the problems that you're actually experiencing. They're merely deflecting the symptoms and deflecting the cause. So you're not treating the actual problem. You're just treating the symptoms. So peripheral neuropathy drugs are not very good. So they fail to address the underlying cause. They only mask the pain that you're experiencing. They do not improve sensory symptoms. In many instances, they make it worse, actually. They can reduce your balance and physical activity, and significant unpleasant side effects occur often. There's a lot of interactions with other drugs with these two, and the last and most important one is they can be highly, highly addictive. So some of the common side effects that we see are nausea, dry mouth, dizziness. Isn't that one of the things that's supposed to help? Blurred vision, confusion or loss of memory, constipation, pain, drowsiness, clumsiness, insomnia, lack of sexual desire and sexual function, and even suicidal thoughts. These are really not things that we want to have to ingest into our body unless absolutely necessary. Now, in no way, shape, or form am I telling you, nor can I tell you medicinally what to do or to take. That is something you discuss with your physician or your specialist. But you can see some of the negative impacts these drugs can have. So here's our approach to peripheral neuropathy and what you need to focus on. So one is focus on your needs and your health goals. So if you were looking for like a drug-free aspect, and you want to address the underlying causes of peripheral neuropathy, such as the inflammation, the oxidative stresses, the cellular metabolism and decreased cellular function things, and improve your functional limitations lost due to peripheral neuropathy, then we may have some solutions for you. So there's proven results out there in published medical journals. I mean, some of the ones you hear of the Journal of American Medicine, JAMA. There's a lot of different very well-known articles and physician-based publications out there. But what we're looking at in there is the ones that are geared towards pain reduction, sensory impairment, balance and reduction of falls, improved sleep, and overall just improvement of quality of life. So getting into our assessment of peripheral neuropathy. So as a physical therapist, some of the things that we can do or what we do. For those of you who don't know, physical therapists are musculoskeletal specialists. We deal with problems from head to toe of musculoskeletal-based issues, pain, tightness, limited mobility, tears, dysfunctions. So first you want to have it designed to assess the extent of the peripheral neuropathy. Determine if a patient qualifies for our treatment, and there's ways to do that, and allow us to design the right treatment plan for you. So here's what we look at with one of our basic checkups, shall we say, and it goes in detail, but first we want to look at the integumentary system. So when you hear that, what does that mean? So some of you may know, but for those of you who don't, the integumentary system is your skin. FYI, the skin is the largest organ we have in our whole entire body. All right, but it also includes our hair and our nails. So there are certain changes that will occur in diabetics with their integumentary system. And then there's the nervous system. You want to assess light touch. You want to look at their proprioception, which is that ability to maintain position and balance and stuff like that. Their ability to feel pressure. Is someone doing something lightly or heavy type of thing? If any of you have ever been to the doctor and they do the little vibratory tool, I know they used to use these back in the day to assess fractures and different things too. You kind of give it a little thing and you put it by your ear and you can hear it humming. Well, you can put that by an extremity and you'll feel that vibration. And in a normal individual, you should feel that. Also see if there's any temperature or nerve pain changes. Then we go to the musculoskeletal system. So you're looking at the strength, flexibility, endurance, and balance responses of those muscles. All right, so we got integumentary, nervous system, and muscular system. Then there's the vascular system. A lot of times you'll see in folks with this, especially diabetics who have peripheral neuropathy, you're going to see vascular changes occur. And that's some of the things that lead to hair changes, nail bed changes, and things like that. And then, of course, our balance system. We have a couple different portions of the body responsible for our balance system, including our eyes, our inner ear, and then, of course, our whole muscular system. Those three things combined, those systems kind of coordinate and control our balance and coordination, all right? So we have like a 3-step treatment protocol that we would say, and there's different components made up of this, all right? So one of the first components is, go figure, physical therapy. It's a program that we use utilizing physical therapy to help treat the neuropathy. So the first thing is we provide specific neuropathy-based exercise program designed by one of our physical therapists, most of which are doctors, in the clinic and for stuff for you at home. So the program may include stretching, strengthening exercises for your muscle, specific neurological mobilization exercises that pertain to your nerves and the mobility or flexibility of them, and then balance and, if necessary, dizziness exercises. Nerves, remember, nerves supply the muscles. So when the nerves are damaged or aren't functioning properly, you're going to see weakness and tightness as a result. All right, we want to work to strengthen those affected muscles and restore normal muscle flexibility. So think about it like your car. If you look at your car, you have this battery in the car, and you have this wire that comes to it. One of them goes to the alternator, one of them goes to a ground. I'm not a mechanic, but I think I'm correct on that. So the bottom line is, if that wire, which is your nerve, is loose on that terminal that goes over the battery, and there's a loose connection on there, you're not going to get that vroom, turn over the car. You might get the or just. So that's the same thing when our nerve's not giving the proper signal, okay? So specific nerve mobilization exercise that we're talking about, so your nerves will move and stretch and what we call glide. That's the best thing a nerve likes to do. So it wants to kind of glide over, glide back. So if I bend my elbow, it glides. When I straighten it, it glides back. That's the best thing it likes. It doesn't like to be pinched, compressed, or irritated, all right? So in a recent study that we looked at, nerves only move generally about 2 to 4 millimeters in people that have diabetic neuropathy. So it's reduced significantly. So this would affect the nerve's function and basically the supplying of the sensation and power to muscles, which can cause a big problem. So from a balance and dizziness perspective, how this works is less sensation, less sensory input, higher risk for balance and fall risk, okay? You can't feel the ground with your feet. You're going to lose your balance, all right? And falls are a huge problem, as I said earlier in this discussion, is that it's one of the big secondary complications to broken hips or legs and a high mortality rate. Sorry to bring that up, but I just need to share that. It's very serious. All right, step 2 of the treatment. So besides physical therapy, there's another form of treatment that we use in conjunction with this that is known as anodyne therapy. So it's light-based therapy. It's a specific unit that we use, all right? And the beauty part about this is you get to use it at home. We don't even need to have this in the clinic. It is something that you can purchase, and you keep and use on a regular basis, okay? The anodyne infrared therapy unit that we use, one, is very successful at relieving pain. It improves the sensation. It decreases inflammation, reduces oxidative stresses, and improves the cellular metabolism and function. These are the big things that I talked to you guys about before, that all those things, if you don't have normal cellular activity, your tissue is going to die, plain and simple, right? Or not function properly. So why would you use anodyne therapy? So number one, and this is a big thing, we have some really cool pictures of this stuff that I could share with you guys too, or send you information on, which is one of the reasons why we're doing this video. We want you to be informed, and if we can help you, great. So anodyne therapy increases capillary blood flow. So the capillaries are your smallest vessels in your body that you have, but it can increase capillary blood flow. So think of like your heart, where the aorta comes out, is the biggest artery, and then your veins that you might be able to see in your arms and stuff like that, they return the blood. So arteries take the blood out from your heart into your body, and veins bring it back, okay? Well, the capillaries are like the little ones going down into the feet, the hands, and getting smaller and smaller towards the tips. But it shows that anodyne therapy can increase capillary blood flow by up to 3,200% after just 30 minutes of treatment. And the cool thing about this is that it actually, when you do the anodyne therapy, if it only covers like here, it actually shows blood flow up into other areas, and it shows residual effects for up to 3 hours after the treatment. So the microcirculation that we call it in the capillaries, a small one, micro meaning small, is greatly, greatly increased. So imagine going from a shade of blue, like a nice beach water in Cancun, to a shade of orange and red, where you're getting a lot better sensation and circulation, like heat and fire, but not in a bad way, okay? So there are really, really good implications to the use of anodyne therapy in conjunction with the therapy. So when you use it, there's a high probability for success. There's tons of articles out there. We have over 14 published studies of nearly 4,000 patients showing the success through the usage of anodyne therapy in conjunction with therapy. But I'm not just throwing this out there. I give you some numbers. So 97% of patients can expect improvement in foot sensation. So if you have numbness or lost sensation or tingling in those feet, you could see up to 97% of you will see improvement. 65% average improvement overall, all right? Tests used in certain studies. We do this little study with this little monofilament where I would take it and I'd press it up against you and ask you in certain portions of your arm or your area. So I might start here. Yes, I feel it. Here, yes, I feel it. And your eyes are closed. Do you feel it now? Do you feel it now? No. So that sensation decreases, but we can validate that improvement just with that quick little test after a few treatment sessions. So it's pretty cool there. So, and when you have loss of that protective sensation, this is the primary reason why diabetics will develop wounds and ulcers and can result in amputation. It could be a disaster. So really, really bad. In terms of pain relief, anodyne therapy, 92% of patients can expect to experience some form of pain relief. Average pain reduction will be about 60%. So if you're a 10 out of 10, the worst pain possible, you might be able to come down to a 4 out of 10. I don't know about you. That means I'm not cured, but I would take a 60% improvement, much like I would take a 60% raise if someone offered it to me. You test this using, there's different studies and stuff like that that you can use, but it's easy. We ask you, and we can validate this with clinical studies to prove this information, all right? Better balance and reduce fall risk. 90% of patients can expect better balance, reduced fall risk, and fewer falls overall. So the average improvement is about 85%. So if you got a mom or a dad that lives alone or live together and you're worried about them and their balance and stuff, and they have neuropathy, this can improve their stability and lower their risk for damage or injury astronomically, all right? There is a third phase of the component to our treatment protocol. So physical therapy and anodyne therapy, so PT and light-based infrared anodyne therapy with a specific unit that we can get for you. And then last phase, step 3 phase, diet and lifestyle modification and activities, all right? So we probably all heard the old adage, you are what you eat. That is true to some degree, but more so, you are what you eat and you absorb. So if your body's not absorbing everything that it should, that could be really bad, and that could be because you're deficient in certain things. So when it pertains to neuropathy or peripheral neuropathy, you want to eat a diet that's rich in fruits and vegetables, whole grains, and lean protein, all right? Could be fish, could be chicken, could be turkey, could be high quality ground beef. This keeps nerves healthy, plain and simple. Those are the things that nourish your nerves. You want to protect against vitamin B12 deficiency by eating things such as fish, eggs, low-fat dairy products, and a good source of vitamin B12 that you can use is even certain fortified cereals too, all right? So if you're vegetarian, the cereals might be a better option for you as far as that goes. So some people need to use that because of their diet restrictions. So, and of course, you could talk to your physician or what have you about B12 supplementation and see what's necessary, whether it's pills or whether it's injection or what have you, but it might be necessary. Also for your diet, potassium is super important. All of your cells require potassium exchange. So really, really important to make sure that that's on par with what you need to do. In conjunction with that diet, what we always talk about too is exercise. Exercise is probably one of the best forms of activity that you can do for your body. It's been successful for generations and generations, And the more and more that you're hearing about it and seeing about it, it's a better form of treatment for pain and other issues than most medications. And there's really no side effects except that you may actually feel healthy, lose weight, and get better, which is cool. So again, you want to exercise regularly only with your doctor's approval. Try to get at least 30 minutes or so a day of activity where you raise that heart rate up a little bit. They make some really cool watches and stuff now. I don't have mine on, but I usually do, that could track those things. Or if you're able to track it and check your pulse rate and keep that pulse up a little bit. But and along with the diet and the exercise, do the things to avoid things that you know is clinically proven to affect nerves and cause damage. Obviously, a big one is smoking, certain chemicals, chemicals in smoking. I'm sure the same pertains to vaping, more than likely. Try to avoid things that cause repetitive motions or cramped positions that could damage nerves, okay? Of course, alcohol, especially in large doses or overindulging in alcohol, is a bad thing as well. So I hope this answers a lot of questions for people about peripheral neuropathy and some of the effects that this can have on your body. Now, here at Cawley Physical Therapy and Rehab, we do something that's pretty cool for all of our patients or for people who are looking for answers, especially for natural healing, and try to avoid long-term effects of chronic medication usage or other things that can be long-term wise damaging to other systems of your body. So we do something known as a free discovery session, which is a free 30-minute appointment with one of our doctors who specializes in neuropathy-based symptoms, and they'll basically go through an examination with you. They'll ask you a real thorough history, because that's one of the most important things. They'll go through some of the tests that I told you. They'll check those 5 systems: your skin, your nerves, your muscles, your balance, and I just blanked on one of them, your vascular system, to see how they're functioning and see if you are a candidate. We have seen so many people with success doing this 3-step protocol. And some people might say, oh, I've done physical therapy before, or, oh, I've done anodyne therapy before, or, oh, I eat okay. And that's fine, but have you ever done all of these things together? And remember, much like there's hundreds of different types of cars out there, even certain makers of cars, Chevy has 100 different cars itself, and not all anodyne therapy is created equal. This is one of the best units on the market right now, and is super, super successful at helping people with their problems. And we have found that in conjunction with PT, anodyne therapy, and a proper lifestyle consisting of good, healthy eating, proper nutrition, and possible additional supplementation if your doctor feels necessary with vitamins and minerals, people do phenomenally well, which is absolutely incredible. So that appointment is free in all 5 of our locations, whether you're near Pittston, Kingston, Nanticoke, Scranton, or Carbondale. We're happy to accommodate you or a loved one that you want to come in and have this issue checked out. And we could tell you more about this and see if, in fact, you are a candidate for our treatment protocol and our program. And you could see the success and relief like so many others that we have helped before, which we are very fortunate to do so. We love what we do, and it's very exciting when you can help make a difference in someone's life. And that's why our motto is make a positive difference in your life. We really want to do that for you. So if you want to get a hold of us, give us a call at 570-208-2787. That's our main office number. Again, 570-208-2787. And we'd be more than happy to schedule you that free appointment, or you could talk to one of our doctors regarding any questions that you have. And also, the cool part about this is all of our Cawley Physical Therapy locations are direct access care facilities, which means we do not need a prescription or a referral from your doctor or insurance company to see you in the event that we could recommend physical therapy for you, which is pretty cool. That's the law in Pennsylvania. We can see you for up to 30 days without any prescription or any referral. So we are happy to do that and happy to offer that. And now we always, though, insist on communicating with your doctor and or your specialist that you're working with for these particular conditions to make sure we are getting the most out of what we're doing with you, and that combining the treatment with the recommendations of things that you've done before, of things that worked or didn't work, really gives the best potential for you to have the best results. So I'm super happy and excited that I had the opportunity to share this information with you guys. And if there's anything that I can do or anything that my team can do, we're here for you. So again, Frank Cawley from Cawley Physical Therapy and Rehab, give us a call, 570-208-2787, and have a great day. Thank you.